A boy with history of frequent eye blinking, then developed throat cleaning, then after a few years developed another tic. How to diagnose? So how do you diagnose tic? Tic is usually diagnosed by history and clinical examination. This is what they are telling, not EEG or CT or anything. Okay. So even if you do EEG and CT, it will be to exclude other diagnosis. So tic is usually diagnosed by history and clinical examination. This is the answer. Most common type of CP, that is cerebral palsy, is it is spastic diplegia. This is all others is not common. Okay. So next question is nerve supply to detrusor muscle. They can ask you this question. So we should pelvic splanchnic nerves and the inferior hypogastric nerve. But whenever such questions come, I always believe in seeing a picture. So we will search for a picture and we will post here and discuss. Okay. So the question here is nerve supply to detrusor muscle. So this is the detrusor muscle here. Okay. This is the marking of detrusor muscle. So what is the nerve supply is the hypogastric nerve. This is the hypogastric nerve, which is sympathetic. And the parasympathetic is the pelvic nerve. That is what they have given. Pelvic splanchnic nerve and the hypogastric nerve. So this is clear. What is the nerve supply of detrusor muscle? Pelvic splanchnic nerve, that is parasympathetic supply, and hypogastric is sympathetic supply. So we should remember this nerve supply of detrusor muscle is the pelvic splanchnic nerves, which will be the parasympathetic supply, and the inferior hypogastric nerve, which will be the sympathetic supply. So we can remember P for P, pelvic splanchnic is for parasympathetic supply. So next question, most common cause of headache in children. Most common cause of headache in children is the stress. Because options, I'm reading options. Stress, sinusitis, increased intracranial pressure, myopia, and migraine. They have marked migraine. So let's read about headaches in children. So the answer is most common cause of headaches in children. The answer is migraine. So most common cause of headache in children is migraine, and in adolescents is the tension headache. The most common form of primary headache in childhood are migraine and the tension types of headache. So the correct answer is D, that is migraine. By the age of 15, 5% of all kids have had migraines and 15% have tension headache. So migraine is the commonest form of headache that is in childhood, but tension type is in the adolescents. And by the age child will reach 15 years, 5% of kids would have suffered from migraines and 15% from tension headache. The most common primary headache syndromes in children are migraine headaches and tension types headaches and cluster headaches. Secondary headaches can occur due to common causes such as hunger and tiredness, and sinister causes such as life-threatening infections and brain tumors. So again, the most common cause of headache in children are the primary syndromes, that is migraine and tension type headache and cluster headache. The secondary headaches can be due to some stress like is hunger. You're hungry, you feel headache. You're tired, you feel headache. and sinister causes such as life-threatening infections and brain tumors. Okay. So let's go to the next question. 10-year-old 10-year-old female fall down from horse, GCS 10, good pupil reaction and good gag and cough reflex, had bradypnea and spine radiology normal. So what is the answer? Uh, there is bradypnea here and also GCS is 10 and she's fall down from a horse. Spine radiology is normal. So do you think there is no spinal injury or there is stem cell injury or spinal injury without there is spinal injury, but the radiological evidence is not there. This is what you will choose. 10 years old female fall down from horse, GCS 10, good pupil reaction, good gag and cough reflex, but has bradypnea. Spine radiology is normal. So it is a spinal injury without radiological evidence. Baby got focal convulsions in the same side of face, arm, after taking milk bottle and completely normal before feeding. Which sign you expect? So there is a convulsion on the same side of face and arm after taking milk bottle, but the baby was completely normal before feeding. Which sign is expected? Important question. Abnormal EEG. May correct if no history of trauma. Suppose if you suspect non-accidental injury in this child, because after taking the milk bottle, there is convulsion. So if you suspect non-accidental injury in this child, your option will be retinal hemorrhage. Okay, that is shaken baby syndrome. Retinal hemorrhage plus there is convulsions, face and arms, means there can be some bleeding or trauma to the brain as well along with retinal hemorrhage. But in the question, if they don't specify you that there is history of trauma, then you have to consider abnormal EEG. This is what he's telling. Any comments on this question? Is it clear?
Oh, sorry, I joined late, but it's not clear to me.
Okay. See, here what he's telling is the baby who is normal before, completely normal before, after feeding had convulsion, focal convulsion. There is focal. The focus where you are seeing is in the face and the arm. Now, what do you think? Maybe sometimes there can be some history of trauma. That is, it can be a non-accidental injury, especially with history of trauma. Here, retinal hemorrhage means usually if the retinal hemorrhage has happened, there is also a chance that there can be some hemorrhage in brain also, right? So this can be the cause if there is history of trauma. If there is no history of trauma, then you have to do an EEG to find out the cause of epilepsy. So if there is non-accidental injury along with bleeding in the brain, there can also be retinal hemorrhage. Did you got my point?
Yeah, I'm getting. Like, you mean to say, is this like non-accidental injury?
Yes, yes. Usually, you should know the non-accidental injuries from head to toe. Like in shaken baby syndrome, you will have retinal hemorrhage. Somebody, if the baby is taking the bottle and somebody has hit the bottle from behind, we know that there will be some frenulum injury. Right. So here there is a point why he has given here after taking milk bottle. So after taking frenulum injury will definitely will not cause you the convulsion. maybe along with that, there is some shaken baby or something which has caused retinal hemorrhage and some bleeding in the brain, which would have caused the focal convulsion. This is what is the explanation. If there is history of trauma, if there is no history of trauma, then you can consider abnormal EEG. This is what he has done. See, here the questions, they have not written completely as it will be in the exam. They have written after coming back from the exam what they remember. Okay.
Yes.
So we have to decide over how to answer. So here we are just giving a reading like the how the pattern and the questions will be there. Okay.
Yes. Thank you. Got it.
Yeah. So 1-year-old infant, convulsion involving neck and trunk only. EEG abnormal irregular wave, that is hips arrhythmia. It is very clear. Infant, 1-year-old infant, and you see convulsions particularly involving neck and trunk. We know that salam sign. Neck will be in flexion and extension of the arms, neck and trunk flexion and extension of the arms. And hips arrhythmia means the diagnosis is infantile spasm. So this is not a difficult question. Child with difficult line insertion had convulsion and now in ambulance. Take about half an hour to reach hospital. He has fits since 2 hours. The ambulance staff call you to give any medication for fits control. So, a child with the difficult line insertion, that means there is no line, and he has convulsions. They are traveling in the ambulance and they have called you to give a suggestion for the fits control. So what do you suggest? Three among these 3 drugs: diazepam, phenytoin, fosphenytoin. Now the option here is there is no line insertion, difficult line insertion. And also, I don't think the first phenytoin and fosphenytoin, they are not the first line, right? In the treatment of epilepsy.
Yes.
So the
It's not
first
the
line
first, right?
here will be diazepam, and we all know that rectal diazepam is usually available in the with the healthcare providers. So the right answer here will be diazepam. So this is also clear. Some questions are will be very clear. Some will be, we will not know. For that, we have to check out. Next question. Patient with signs of meningitis, but H influenza negative and started already on ceftriaxone. Continue treatment till cultural result appear. So he has just given here as a sentence that there is a patient who have been diagnosed with meningitis, but not from Haemophilus influenza B. So, and also the patient is started on ceftriaxone. What do? You continue till the culture result appear. Then you will decide over whether you want to give another antibiotic or what you have to do. Okay. So if any problem, please stop me so that we can, before continuing to the next question. So is this question clear for you?
Like
Tell me.
duration of the treatment is different in different organisms.
Yeah. That's why we will wait for the culture and then we will decide over. And also if there is meningitis from Haemophilus influenza B, you have to consider also DEXA, right? Dexamethasone.
Yes.
A case of breath holding spell. So breath holding spell, no investigation is needed. So they will give you some options. In that you have to choose that no investigation will be needed. It will be a clinical diagnosis. Patient with seizures, no focal lesions. So patient with seizure, usually you will consider him as epilepsy, and your choice will be no focal neurological deficit. Here no focal lesions means no focal neurological deficit or something. So you will consider EEG. I hope this is also clear, not a problem. Girl trial to ride a horse and she fall down. GCS 10. Normal spine on X-ray neck, but she cannot move her legs. So X-ray neck is normal, but she cannot move her legs. What is the best management? GCS 10 is good, so no need for CT brain, but MRI neck. So here, that means from the X-ray, there is no radiological evidence of injury. So you have to do something else which will show the injury. Why we are suspecting injury here is because she has fallen down from a horse. Definitely, horse means it will be a quite greater height, okay, significant height, and her GCS is 10. The X-ray spine is normal, but there are symptoms in the patient. The symptoms is she cannot move her legs. So you will do MRI. MRI maybe only neck or the whole spine to see the lesion. Is this clear before we move ahead?
Yes, there.
Okay.
It seems some spinal injuries there.
Yeah, spinal. So we will do MRI to be clear. According to them, why no CT brain? Why you're not choosing CT brain and why you're choosing MRI neck is GCS 10 is good. It's not very bad. It is acceptable. So no need to do urgent CT brain. We will consider MRI neck, they are telling. Okay. Healthy father with hydrocephalus. Healthy father with hydrocephalus with meningocele has another child with meningocele. The father is healthy. A healthy father with hydrocephalus with meningocele has another child with meningocele. Recurrent risk for another child with same problem. So what type of inheritance is this? Hydrocephalus with meningocele.
I think there is like nothing with the inheritance, but the chances are increased if the one of the parent or one of the child already with the same condition, then the chances increased in the next pregnancy.
We have to check this. The question here he is telling is healthy father with, he is healthy but he had hydrocephalus and meningocele, right? The
Healthy
father
father
had, maybe, I don't know, he is not clearly written here. And he has a child with meningocele. Still has another child. Or I think the father is healthy, but he has two children, two siblings with one with hydrocephalus with meningocele and another with meningocele. So recurrent risk for another child with same problem. We need to check this meningocele recurrence. Okay, I will do one thing. I will post you now another link to join, and at the same time I will check and we will join and we will discuss there. Okay.